Well, meanwhile, Manitoba has begun immunizing First Nations people who live off reserve and are 75 years or older. But Métis and Inuit people of that age group are not being vaccinated. The province's chief medical officer was asked about that at a press conference today.
There are, a number of risk factors for the vaccine. It's a complicated rollout when you're dealing with scarce vaccine supply.
5 days ago, the province started vaccinating members of the general public aged 95 and older. First Nations people who live off reserve can get vaccinated if they are 75 and older. Vaccines have already been given to even younger First Nations people on remote reserves. The province says First Nations people have been disproportionately affected by the pandemic. Well, the rules in Manitoba differ from provinces like BC, Alberta, and Ontario, who have made all Indigenous adults priorities in their vaccine rollouts following federal direction. And our next guest says that's how it should be, saying Inuit and Métis communities shouldn't be ignored in Manitoba since they're just as vulnerable as First Nations communities. David Chartrand is with the Manitoba Métis Federation, and he's taking matters into his own hands, sending letters to 4 vaccine manufacturers asking to buy doses directly for his community. He's joining us now from Winnipeg. Hi, David. Thanks so much for taking the time to chat with us. I want to ask first why you've decided to go this route and basically circumvent the government who isn't prioritizing Métis and Inuit groups. You're trying to go directly to the source.
Well, thank you, Ginella, for having me on the show. But let me say, as I listened to the previous messages coming from across Canada, how provinces are rolling out the vaccines and the ecstaticness of many that are getting it, then I could just pray that that would happen to my people in Manitoba, because it's not. We don't have the luxury of even being planned on that we're going to get a vaccine or when. All vaccines apparently right now have been committed past April, so we are not included at all in any of that. So I could just wish in anticipation and envy as I watch everybody else in the country, and I watch 125,000 Métis people in Manitoba being left out. It is a very scary thing to be in that situation, and there's no excuse beyond politics. And it is quite sad, and I'm very pleased that Mr. Vandel has written now twice to the Premier, challenging the Premier to why he would just leave out the entire Métis. Of course, for most media out there have been pressing the Premier, he keeps on saying, "Oh, show me the data that you're Hill." Well, we did a study, and we actually died 21% before all Manitobans before the age of 75. We have 40% higher heart disease, respiratory problems, diabetes at 34%, and surpassing First Nations. The National Advisory Committee Immunization also sends a message that Métis got to be treated equally as First Nation, because we know they have high chronic illnesses, but that's not what's happening here in Manitoba, Ginella.
So I mentioned that you've reached out to Pfizer, Oxford AstraZeneca, even Johnson & Johnson, which hasn't even been approved here yet. You had a call with Pfizer this afternoon. How did that go? What did they say? I wish governments would work in this fashion. I sent a letter out this weekend to also sent one to Cuba. I sent one to, of course, Pfizer, Moderna, AstraZeneca, and Johnson & Johnson. And Pfizer immediately responded the day after. And we had a good discussion with Bob Dawson, the Vice President of Canada for governance and distribution for Pfizer. We had talked about 45 minutes. I was very pleased with the reaction and the extending of hope that could come our way. But of course, we know the world is pressing all these manufacturers to get theirs. So where I'd fit in the queue would be a big challenge. But there's always hope. And I had a very good discussion. I'm very proud of how quick they reacted and have a discussion with me and saying, look, let's see what can happen. But right now, we are so caught in our orders that if we were to recognize you as a Métis government and government-to-government relationship, because that's how they only sell to governments. And so from that perspective, if we put you in a queue, they said it'd be way down the bottom line. But there's always hope. So he's going to check up on a few other matters, and he's going to get back to me in a couple of days. So I'm hoping and praying, and I haven't heard from Moderna or AstraZeneca yet. Johnson & Johnson, of course, just got approved in the United States, but I did write to Cuba, and I'm going to follow up with that because their vaccine apparently is being rolled out. And so I'm not going to give up on this because there's no other way for me to turn. I have nowhere to go for my people, and it's a scary thing. And our people are dying too, like everybody else.
And but even on the age bracket, Janelle, people understand this. We're putting the main population, and they're saying that main population is 95 and up, and we're dying before 75. And so we're never going to see that. You put a main population out there, the Métis are guaranteed not going to fit in there. That's why First Nation went 75 and up. But I think they're wrong. You should go 60 and up, because Indigenous people are dying faster than anybody else and around that range because of all the chronic illnesses that we suffer. And so every study's telling, every indication, every science, epidemiologist is all saying, give the people that with the highest potential of heart disease, diabetes, give them first, along with first responders, and of course the seniors. Elders, I don't care what color you are. I believe 100% elders got to come first, and seniors. That is our culture, and that's the way it's going to be. But right now we're suffering that we don't have no hope in hell under this Premier in Manitoba. This is not about data. It's not about all the science in the world can come there. This is about politics, and the Premier is punishing us for standing up against them.
All right, David Chartrand with the Manitoba Métis Federation in Winnipeg tonight. David, we'll keep watching this story to see. As we mentioned, Manitoba here is an outlier. Most other provinces following that federal direction to have all Indigenous people prioritized in vaccination. Thanks for the time.
Like I said, Janelle, my people are praying, and we will get there one way or another. Thank you very much.
Thanks so much. All the best.